Hello, welcome to MamaTalks. Today I am joined by Dr. Jessica Voge, who is an OBGYN in Portland, Oregon, and we are going to be talking about sex after baby. Dr. Jessica, do you want to say a word about yourself and your work?
Sure. Yeah. I'm from Portland, Oregon. I was born and raised here and went to medical school initially thinking I was going to be an orthopedic surgeon and discovered that I wanted more continuity with my patients, but I still love to operate and I love quality of life issues. So it's really fun that in OBGYN, for the most part, I get to take care of really healthy young people who are just trying to live the best lives that they can. And so that's kind of what got me drawn into OBGYN. And it's funny that we're doing this conversation today on Valentine's Day. When I told some of my friends, many of my friends and family, when I made that switch from orthopedics to OBGYN, they were like, duh, you're always the one that has the funny comments about sex and things like this. And so it was not a surprise to people who knew me well that this was the path that I was going to be pursuing for a career. But it's great. You know, I love taking care of women of all ages, and I love having conversations with women about the same things that I'm going through, that I've gone through. I have two young kids. I have a 4-year-old and a 7-year-old. So I've been pregnant. I've been postpartum. I've gone through it. My relationship has survived it, sometimes barely, but it's, lots of challenging things that our bodies go through and we go through. And I love to help people get through that themselves.
Thank you so much. A great intro. So one of my first questions is, when we're talking about sex after baby, is there a time limit for when you should wait to have sex? And does that differ based on if you had a vaginal birth versus C-section, or if you had some kind of complication like tearing?
Sure, that's a great question. And it's something that commonly people are told 6 weeks, wait 6 weeks before you have sex. That is sort of an arbitrary point that we have designated and we kind of stick to. The real potential risks, what we're trying to avoid is, number one, we don't want you to get an infection inside the uterus. So, the uterus expands for baby, the cervix opens up. Whether you're having a vaginal birth or not, the cervix does open. Whether you have, a C-section or a vaginal birth, there's some opening and dilation of the cervix. And that's up at the top of the vagina. That's the entry to the uterus. So after delivery, the cervix will start to close down as your uterus shrinks and shrinks and shrinks over the first few weeks and months. And we want to make sure that that cervix has closed enough that inserting anything into your vagina or going swimming or hot tubbing, those other restrictions we might have after delivery, we don't want to introduce bacteria and infection so you get an infection inside your uterus. For most women, that's probably going to be around 3 to 4 weeks when that risk kind of starts to subside. A good marker of that for your own body is when your lochia goes away. And the lochia is the postpartum bleeding. So usually it starts out pretty heavy, red, like a period, sometimes clots passing, but then it kind of, calms down. And for weeks, it can go on as sort of this like brown, bloody discharge. That's called lochia. And when the lochia has really stopped, that's a good sign that your cervix has closed down enough that you're not going to be having introduction of bacteria inside, and the risk of infection in your uterus is going away. There's also the vaginal healing. So for someone who's had vaginal birth, most people have some sort of tearing, a little bit of suturing needed. So we really want that to be fully healed and intact before you try and stretch that out with sex. And so that for most people is probably going to, again, be 3 to 4 weeks. For some people, it can take up to 6 weeks if they've had a more extensive tear. So the reason I say 6 weeks for my patients is because I have them come to the office at 6 weeks. I do a physical exam. I take a look, make sure it looks healed. I see if it's painful for them. And that helps guide. So 6 weeks, for someone who's had a totally uncomplicated C-section or an uncomplicated vaginal birth with no tearing, probably 4 weeks would be fine. But the other reason we say 6 weeks is often that's when we're seeing them back in the clinic and making our final plan for birth control. So I know we're going to probably talk about birth control at another date and have a more extensive conversation about that. But it's good take-home message is it's really variable when people start ovulating again and start making and releasing eggs, and when you could potentially get pregnant. So it's really important that before you start having sex, you have a plan for birth control. And that's why we say, let's wait till the 6 weeks, because that's often when we'll initiate some sort of birth control for people who are interested in having sex. And then as far as C-section versus vaginal birth, more tearing potentially with vaginal birth, so maybe more healing time needed for the vagina. The cervix kind of shrinks down about the same amount of time for both. So I don't think that otherwise there should be much of a difference between C-section and vaginal birth about when you're able to resume having sex.
Okay, thank you so much. So we're looking
Yeah.
at the cervix closing down to decrease infection risk, and we're also looking at vaginal healing as well as contraception planning for those things to be in place. So besides just kind of the issue of when are you physically ready, a lot of couples will struggle with low desire or a decreased ability to orgasm with sexual intimacy. Can you speak to that? Like, what are the causes for that? Is it hormonal or just people are really tired?
Yeah, tons and tons and tons of causes. And this is just so timely that my husband for Valentine's Day, part of my gift was this. I don't know if this is going to be backward when you read it. It's a candle. The kids are finally in bed. You know what that means. And then in parentheses, it says sleep. So he knows me well. He knows that after having babies, if the kids are finally in bed, that may not be fun time for us. That may be sleep time for mommy. So lots and lots of things happen postpartum. There's the physical changes, physical discomforts of sex. There's just fatigue. And then there's huge hormonal shifts. So I really, like to take this back to just general biology and physiology and evolution, really. When you think about when we were out in caveman days and a woman was out, trying to procreate, have babies, men just want to have babies. That's their goal, is they just need to have more offspring. That's going to guarantee that their genes get passed on. For a woman, yes, that's true, but she can't just get pregnant over and over and over and over again, because she actually has to continue raising that baby to make sure that they're going to be able to be independent enough before getting pregnant again. So our bodies are super smart, right? When we're making and releasing an egg every month, the brain is driving that. The brain tells the ovary, hey, ovary, make and release an egg. If you don't get pregnant, you do it again. And the hormones go up and down each month, right? Postpartum, here's what happens. Your estrogen levels during pregnancy go up, 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 and then you deliver, crash. Your estrogen levels crash down. So just like when a woman becomes postmenopausal, stops making and releasing eggs, and her estrogen crashes, postpartum women initially have that huge crash in estrogen. What that does, one thing it does is women get night sweats and hot flashes. We often don't talk about that and tell women to expect that, but that is a symptom of low estrogen. So in those first few weeks, you wake up to feed your baby and you're covered, your pajamas are just drenched in sweat. It's because of that drop in estrogen. But the other thing that drop in estrogen does is it also makes your vagina sort of temporarily a postmenopausal vagina. So women who have gone through menopause sometimes struggle with vaginal dryness, pain with sex, and the same thing happens to postpartum women initially. It doesn't mean that it's going to stay that way forever, but initially you end up with vaginal dryness, and it's just not very stretchy and pliable. And so that then can make sex painful. Anyone who has ever had pain with sex knows that it's really hard then emotionally and mentally to sort of get psyched up and have that desire to have sex again, because it's like, oh, it's going to hurt. I don't know, it's going to hurt. So that then becomes the sort of cycle of it's painful, it's hard to desire it, it's painful, it's hard to desire it. But then let's just go back to like our emotions and what we're wanting to do. When you are postpartum, there is no reason that your biology should want you to be having sex. So when you're ovulating, your hormones are going to start driving those pheromones and things. And yeah, I'm kind of feeling frisky. When you're postpartum, your body has one job and one job only, and that is to keep that baby alive for a few more months until that baby can start doing more things independently. So with your estrogen dropping, your testosterone drops, your libido drops. And then also the prolactin, which is the hormone that makes you be breastfeeding, makes the milk be made and coming out before baby, actually was really involved in the bonding with your sexual partner. You would have a rise in prolactin with orgasm and make you feel really bonded to that person. Whether this is fair or not, when you're postpartum, that prolactin level rises and bonds you to baby. So it can be sort of this weird sort of, triangle effect where you have your bond to your baby and you're bonded to your partner still, but that really sort of like visceral bond is to the baby. And it should be, because that's where your responsibility lies. So those are kind of some of the main hormonal reasons why postpartum women don't have a huge libido. But then you also factor in the pain, potentially pain with sex, healing from the delivery, body image issues. Your body is not going to be back to the pre-pregnancy body. So women just don't feel sexy. Breasts, a huge erotic zone that normally would have, come into play potentially before getting pregnant, now belong to the baby. You're making milk. That doesn't feel super sexy for most women. So there's all of those reasons. and then sleep, fatigue, sleep. So that's, another huge factor. And I often will talk to patients about this even before they deliver, just saying, we say 6 weeks is a safe time to have sex, but that doesn't mean you're going to want to. That doesn't mean it's going to feel good. And it used to be before COVID, before coronavirus, we would have partners come at least to some visits in the clinic or be there, when we were having these conversations postpartum. And now most people aren't able to bring their partners to their visits. And so I think it's done a huge disservice to this conversation, because I used to love to say to women, like, I talk to them, but then I'm talking to the partner as well, right? 6 weeks is when it's usually safe to have sex, but that doesn't mean that that's when you guys are going to be ready. And it's different timing for every couple. Breastfeeding plays a role in that for sure. Because once you stop breastfeeding or stop breastfeeding as frequently, that's the signal to the brain, oh, okay, I guess this baby's not needing quite as much from me. Maybe we could go ahead and get pregnant again. That's when periods, the menstrual cycle returns, and that's when your hormones start to normalize. The vaginal pain improves, all of those things. So that's, usually when our bodies sort of start to get back to normal.
When do you find that the hormones start to return back to normal and people start ovulating on a regular basis again?
Yeah, it's really, really variable. For some women, it's not until they complete breastfeeding, wean at a year or even later. For most women, it's going to be closer to the 6 to 8 month period. And this is for people who are breastfeeding. So for a woman who is breastfeeding, only giving their baby breast milk, meaning not supplementing with formula or donor milk, all of the baby's nutrition is coming from mom's breast, whether that be pumping or breastfeeding. Usually around 6 months is when we're starting to introduce more baby foods and different things. So the baby's getting more and more calories from other sources and usually getting less milk from mom at that time. And that's kind of a trigger to the brain to have at least an occasional period. It may not be a regular cycle yet, but that's usually when those periods are going to start coming back. That being said, some people will start ovulating as early as 6 or 8 weeks and getting periods much earlier. We do think that there's a difference, if someone's exclusively giving breast milk versus supplementing, that will allow that body to sort of wake up and start cycling again. But also if someone, has gone back to work and is pumping every 6 to 8 hours rather than nursing on demand, even though you may be making the same amount of breast milk total, having those longer spaces, longer gaps between the expression of breast milk will allow the body to start to cycle again. But the main point about that is when you have your first period, it is because you have already ovulated. You have already released one egg and didn't get pregnant, and that's why you get the first period. So waiting for your period to come back is not an okay way to say, okay, now it's time to contracept, because you've already had a potential risky moment.
Okay, gotcha. Sorry, just to clarify, earlier, did you mean prolactin or oxytocin for the bonding and the orgasm?
Both.
Okay.
Yeah, I said prolactin, but both are involved, and then actually really involved with dopamine as well. And so all of that can drive sort of the desire, but also what happens after orgasm and bonding.
Gotcha. So are there any sort of tips or advice that you have for women who are feeling this low libido but wanting to kind of get back to their former selves?
Yeah. I kind of defined this moment between 6 weeks and 3 months postpartum as sort of the window about when people are going to be wanting to have sex or not. That's pretty variable. Some people come to that 6-week visit and they're like, okay, is it go time? I'm like, okay, if you're ready, sure, that's fine. But a lot of women are not going to feel that way until closer to 3 months, or even like really feel that they want to try. So I think for that window of time, I just really encourage people to listen to your body, listen to your heart, and talk to your partner. I think that's the best piece of advice I can give. That's why I really love it when people can include partners in that postpartum visit, even if it's just on speakerphone or FaceTime, because then they can at least hear the conversation, hear somebody other than their partner say, you may not be feeling up to it. Biologically, there's no reason why you should want sex. That can help sort of take the pressure off. She doesn't find me attractive. She doesn't want to have sex with me anymore. No, that's not it. Her body is physically being demanded to do other things right now. That doesn't mean that she doesn't find you desirable. It just means she's got a lot of other things to be focused on right now. So I think as far as, talking with your partner, making sure they understand biologically what your body is going through can be really helpful. I think that trying to find other ways to connect. By the way, men also have that rise in prolactin postpartum. So often their libido and desire for actual sex goes down too. They may not be willing to admit that, but biologically that actually does happen in the first few months for many men. So it doesn't mean that they don't want to connect. It doesn't mean they don't want to have a romantic relationship, but they may not feel like sex is quite as important. So talking to them, figuring out ways that you can connect as a couple aside from baby. So whether that be, having a little date time, a little dinner time. I know, again, it's hard with the pandemic, but trying to find ways to sort of still have a relationship that's not all surrounded around the baby. And then when both people are feeling at least kind of willing and ready to want to try to have sex, do not try and plan for that to happen right at bedtime. Bedtime, when the baby gets the first stretch of sleep of the night, is potentially going to be the longest stretch of sleep the baby's going to have, and therefore that mama's going to have in those first few months. So, whether it be 8 to midnight, 9 to 1, whatever that time is, waiting for baby to go to sleep and then to stay up to have sex is just basically saying to mom, you're not going to get the sleep tonight, you're having sex instead. And that is often going to be a big barrier. So it's a much better idea, if you're able to sort of plan for it, to go earlier in the day, late morning when baby's down for a nap, early evening, something like that, rather than saving it till right at bedtime. That's really when we want to focus on mom getting sleep, because no woman is going to feel sexy and desirable and want to have sex if it's at the expense of her very minimal sleep in those first few months.
Oh my gosh, that's totally true. I didn't realize we were doing that, but like we kind of shifted to the afternoon nap time without even consciously thinking about it, because at night we're just so exhausted,
Absolutely. Yeah. And then I think really talking about the physical discomforts too. I think we'll probably talk a little bit more about pain in a minute, but a woman can say, in her heart, in her mind, I want to get back to having that physical relationship with my partner. I want to have sex. It used to feel good. I want it to feel good, but it's just a big barrier. It just doesn't feel good. Like, what can I do about that?
Yeah. What do you recommend for discomfort with sex?
So, some of it can just be from vaginal tearing with delivery. And often what happens is it heals just like any part of our body. It heals first, like the actual skin comes together and there's no opening, there's no wound, but then there's like a layer of scar tissue. And sometimes that does just require time to sort of soften and stretch and become more flexible. But a really, really, really big aspect is that drop in estrogen. So the dryness, less flexibility of the tissue. So what I tell people usually at their 6-week postpartum visit, and then we sort of circle back around if they're still having problems around 3 months, come 3 months postpartum, if they're really wanting to have sex and it's the pain and the discomfort that is limiting them, then we'll talk about using some kind of treatment. So first and foremost, lubricant. Absolutely use lube. And for postmenopausal women and postpartum women, it's not so much a wetness issue. So using just like any old lube isn't necessarily going to help. It might make things more wet, but it's not going to help with the discomfort. So like KY, Astroglide, those are water-based and they're fine, generally speaking. But for this low estrogen issue, the tissue is really sensitive and fragile. And so it can have like a friction sensation, and that feels like sandpaper. That does not feel good. A silicone-based lubricant is going to be much better for those women. So there's a bunch of different brands out there, Uber Lube, Silk, slippery stuff, but a silicone-based lubricant, you don't need a lot, just a little bit, because it's not so much a wetness issue, but it's more a friction issue. A little bit really, really takes away that friction so it doesn't become so traumatized. You don't feel so painful after sex. So absolutely lube. And I'm going to put a little plug in for Shebop. That's a local Portland store, but they have a website so people can order from anywhere. And it's a women-owned, female-owned, female-directed sex shop. So whatever you're looking for, yes, it's amazing. And it's just, it's really empowering. And now, I mean, obviously you can do everything online now. You can buy stuff online. So, but even online, you don't feel creepy looking at their website. You feel like a woman who's empowered to, take care of her own body. So, so a good lubricant. And then if it's still painful, absolutely talk to your provider, talk to your doctor, talk to your midwife, because this is a common reason that we would prescribe vaginal estrogen. We do that for postpartum women or postmenopausal women. We certainly can do it for postpartum women as well. A little bit of vaginal estrogen cream to the vagina, usually like maybe twice per week, can help sort of restore the flexibility, pliability of the vagina. You wouldn't necessarily use it forever, but use it at least while you're still breastfeeding, while those hormones are low. If you use it in low doses, you don't get systemic absorption. You don't get a change in your body's hormones, but it helps treat the tissue of the vagina. So that can be really helpful to sort of get the vagina in line with how the woman's heart and brain are feeling as far as desire. But if all the parts aren't working together, that's not super helpful. So you'll need a prescription for that, but it's absolutely worth reaching out for. You can even go look up the diagnosis for this problem is called lactational, so breastfeeding, lactational atrophic vaginitis. And basically it just means low estrogen to the vagina while you're breastfeeding.
Got it. Yeah, those are really, really great tips. I will just add one other thing that was helpful for me was like it wasn't so much the dryness, but I was holding a lot of tension in my pelvic floor. So I went to see a pelvic floor PT who did some manual therapy, and that was actually really helpful because I wasn't aware that I was like unconsciously clenching during sex, maybe because of like I don't know, like stress from the birth or whatever. But that was also helpful to me.
Yes, absolutely. And I mean, physical therapy is one aspect of this, but I will also say, and if your partners are watching this with you, especially on Valentine's Day, I'm so sorry that the doctor is bringing up masturbation. But touching yourself, especially postpartum when you're not sure how things are gonna feel, that can be really scary to say, all this stuff just happened down there. I haven't really even looked or touched, and now I'm supposed to let somebody else be down there. I would really encourage you, it doesn't mean you actually have to masturbate, but definitely if you're at all considering having sex with your partner, take some time just to touch and feel, see what parts hurt, see what parts don't. Try and relax and say, oh, okay, I have control over those muscles. I can relax that a little bit. And certainly if sex is being painful and you're clenching and it feels just like, oh, it's just not going to fit or whatever, then a physical therapy evaluation is going to be really helpful too.
Thank you. Yeah, that is excellent. Touching, feeling, masturbation. I think those are like even more key after having a baby. I just have one last question. And I think a lot of times physical intimacy is also dependent on how your relationship is going. And there's a lot of stressors right after you have a baby. Heard a lot of people, mention that they might feel resentment, like their partner is stepping up as much to take care of the baby. And so they don't want to devote any time to physical intimacy. Have you found any sort of conversations to be helpful for having with your partner to make sure that women are actually emotionally supported during that time?
Yeah, this is tricky. And obviously, there's lots of different types of relationships that enter parenthood together. And some are just going to naturally be a little bit more successful at these types of issues than others. But I would say, and again, this is really hard during the pandemic, but trying to include your partner during the pregnancy as much as possible so that they feel like they're part of what's happening, part of this pregnancy, part of the birth, part of the postpartum, so they don't feel so sort of separated from it. So whether that be bringing them in for visits, on FaceTime or speaker, but then also for the postpartum visits, and then having conversations with them, even if they can't come to the visits or be involved in the visits, but having conversations. Hey, I went to the doctor today and this is what we talked about. I think taking the pressure off of the woman who's just gone through this huge birth and having all these hormonal changes and not having it so much come from her, like, this is what I'm needing right now. This is what you're not doing right now, but saying, this is what it has been suggested to me. This is what other people have said have been helpful, can sort of take the pressure off the relationship a little bit and say, this is totally normal what we're going through as a couple. I think a lot of women feel like they're being bossy if they're delegating stuff out. They feel like they should be able to do it all themselves. The truth is, when you come home with a newborn who's needing to feed every 2 to 3 hours and you're in charge of breastfeeding, that is a huge chunk of your day that you just cannot do the dishes. You cannot do the laundry. You cannot get it all done. And it feels really like you're nagging to be like, can you do the dishes? Okay. Can you go make dinner? But somebody has to do it and you have a job to do. So trying to discuss that with your partner and explain that and say, I wish that we could share this workload more evenly, but right now I have to sit and do this because this is what our baby needs. And what our baby also needs is for you and I to have dinner tonight. Can you go make that happen? So that, they really feel connected. I think a class, a class before delivery, often people will do birth classes, but also like the breastfeeding and newborn basics type classes that you can sign up for. There's only so much preparation you can do about breastfeeding before baby comes, but I think it is really helpful to bring the partner into that sort of planning, just to let them know that they're part of it. If they're not breastfeeding the baby, they at least can be doing other things to help support the person who's breastfeeding the baby. And then one thing that I have found super helpful with my husband, and granted, we do not have newborns, we do not have babies anymore, but just when chaos happens during the week and we're like, gosh, there may or may not be any time to even think about sex, but there are other ways to let the other person know that you care and that you're, desire them and all of these things, is just actually asking, how can I make you feel loved this week? and both people doing that, because it may be, women are feeling really guilty. Gosh, he probably really wants to have sex. It's been how many months? Oh my gosh, feeling guilty about it and not even asking, what does he want? So if you ask your partner, how can I make you feel loved this week? He may say, I would really love it if we could have, candles at dinner time, or if you could pinch my butt when you're walking past me in the kitchen, or whatever it is. But we put a lot of pressure on us that it's all about sex, and it may not be for him. So make sure you guys are on the same page about what you're both missing and desiring in the relationship. So how can I make you feel loved? I think that's a really great question to ask, and both of you can share together. And that just kind of helps open up the conversations. Not what am I missing? What am I not doing? How can I make you feel loved? What are you desiring?
Thank you. That makes so much sense. Just checking in with each other. How can I make you feel loved? That's excellent. And just like you said, that whole newborn breastfeeding, that is a full-time job, and it's okay to delegate because you're already full-time occupied. Is there anything else you want postpartum folks to know?
I think just take care of yourself. It is not an obligation, should not be your obligation to have sex postpartum. I loved it that you initially titled this Better Sex After Baby. And I was like, oh, maybe it should be realistic sex after baby. But the truth is you've got to feel good about yourself. You got to be taking care of yourself before you can give to everybody else. So, and that includes asking for help, telling people what you need. So none of us are good at doing that, but feel empowered to do that. That is your job as a mom, is to speak up when you need help and speak up for what your needs are.
Well, thank you so much, Dr. Jessica Voge, OB-GYN in Portland, Oregon. I so appreciate you coming on here and talking to us.
Thanks for having me.